The FCC and ICNIRP limits do not protect humans from any adverse effects that could arise from exposure to radiofrequency electromagnetic fields. There's a number of reasons. First of all, the limits were based on studies that were done in the 1980s, and the limits were initially established by ICNIRP and the FCC in the late 1990s using those data. So the experiments that were done in the 1980s were done with a very small number of rats and a small number of monkeys, like 8 rats, 6 monkeys. And they were exposed for very short terms, less an hour or less, to different frequencies of radio frequency electromagnetic fields. They were food deprived, so when they hit a lever, food would be delivered to them. But then as they increased the exposure intensity, they were trying to determine at what level of exposure intensity would they slow down in terms of seeking food by hitting this lever. Okay, so this is considered a behavioral effect. It was for 1 hour. It was done in a small group of animals, so it had no understanding of longer term effects from radio frequency radiation. And they determined that there was an exposure level, and the exposure level is described as an absorption rate of energy called the specific absorption rate. And it has a value, if I can just port it as 4 watts per kilogram. It's just a numerical value to keep in mind. That was a threshold. From that, they then determined that let's come up with, they call it a safe level. They say, let's apply safety factors. Well, a safety factor should be a factor which guarantees safety. But in the real world, these are called uncertainty factors because you're not certain whether it's providing safety. So for workers, they just applied a factor of 10 and said, this is an arbitrary value. For the general public, they divided by another 5. So these are arbitrary values that have been given. Numerous experimental studies done in the last 30 years have shown that there are adverse effects that are occurring below 4 watts per kilogram and even below the values that, after applying these arbitrary uncertainty factors and then implemented into a an exposure limit value in the 1990s. And what's even more startling is that in the around 2019, 2020, when much of this information has accumulated, they kept the same exposure level as they put out in the 1990s based on the experiments from the 1980s. So what you have now is a value based on, it would be laughable if this type of research came to a regulatory agency like the EPA and said, this is a threshold. There's no characterization of the health effects. It's done in very small number of animals, very short-term exposure, no information on chronic effects, and it's done in adult animals. So you have no idea what this means for children. And for children, there's a greater importance because children are exposed for a longer term since it's a new technology, relatively new technology, from probably their entire life. We also know from many studies in toxicology that the developing organs are more susceptible to a stressor in the environment, and this would be radio frequency electromagnetic fields that could impact in a negative way the development of organs within a growing child. So we need to be extremely careful of what this might mean for children as well as for pregnant women. Because if a person was to put their cell phone on their stomach and you have a developing fetus exposed to radio frequency radiation, you have no idea what you're doing to that developing fetus. And the problem is the FCC and ICNIRP limits do not address these concerns.